Have you ever wondered what your life would be like if you didn't have to wear contacts or glasses, or if you had 20/20 vision? Dr. Jeffrey Gold is a board-certified and award-winning ophthalmologist. He's also the owner of Liberty Vision. He's here today with Janice Christopher, the marketing director. Nice to have you both here.
Thanks for having us.
Nice to have you in front of the camera,
Thank you
Janice.
so much.
So you have a lot of interaction with patients at Dr. Gold's practice. What typically is the motivation you're hearing?
So a most recent story was from a patient who was talking to me about how she always had to plan when to wear her contacts versus her glasses. Because she gets a lot of eye infections, she'd have to limit the time in contacts. So if she was going out for dinner, let's say, with her husband, she'd have to wear glasses to work, even though she didn't want to, so that she could have contacts on at night. And so her whole life was planned around when can I wear my glasses and when can I wear my contacts.
Oh, what a pain,
she got tired
right?
of that, yeah.
And then people probably just want to wake up and see the clock and just have vision right off the bat, right?
You know what, when I ask people, I see people before their surgery, immediately after, and then after a week and 2 weeks. And I ask them, what's different? Like, what's happening with you? And they often report, wow, I wake up in the morning and I can see the clock. Or I get up in the middle of the night and I can see around my room, which is fantastic.
Absolutely. And Dr. Gold, let's talk about your practice just for a minute, because patients see you directly.
Right. I think my practice is unique in that I don't have many assistants. I don't have optometrists doing the screening exams and actually planning the surgery, and then the patient doesn't meet the surgeon until the day of surgery. I think that's a really bad way to go. And I recently worked for a woman who went through a system like that many years ago, and her workup was done by an optometrist. A lot of her screening tests were done by technicians, and there was miscommunication between the optometrist and the surgeon, and she didn't get done what she wanted to have done, which was monovision. And so she came to me to have the monovision created, and now she's reading without glasses as well as driving without glasses.
That's terrific. And obviously we're talking about laser vision correction, Epi-LASIK and LASIK. Why don't you tell us the difference?
Okay, we can use this model to show the difference. In LASIK, the cornea is cut open and a flap is created, and the laser change happens in the bed of the cornea. The flap goes back down and the edge seals overnight. However, the interface between the flap and the bed of the cornea never completely heals. And I think we have a graphic that also demonstrates that. And in the picture on the right, you can see that there's a LASIK flap having been opened, and in the picture on the left, you can see that there's no flap. So Epi-LASIK is way safer than LASIK because nothing is cut and there's no issue with an area that doesn't heal. So people who have had LASIK are vulnerable for the rest of their lives. If they get hit in the eye just the wrong way and the flap comes loose, they've got 1 hour to get it fixed, or they're going to need a corneal transplant. And in the graphic that's on your screen right now, you can see that I use a blunt tip separating device just to separate off the surface layer of cells. Those are called epithelium, and that's why the procedure is called Epi-LASIK. Dramatically safer than LASIK in the short term because there's no cutting, and in the long term because there's no flap to get knocked loose.
Sure. And we know that Janice was not a candidate, hence why she has the glasses on. Who typically is a good candidate?
Typically, anybody over the age of 18 whose vision has finished changing, and I demonstrate that by reviewing their last 3 eye exams for 3 years. And if they've finished growth and their eyes have not changed, then they're candidates unless one of our initial scanning procedures, which I perform when a patient first comes in the office, shows that the cornea is misshapen in a couple of specific ways. And there are a couple of corneal degenerations that if people get to a certain point in life and they haven't had a problem with their cornea, they'll probably get through life without any difficulty unless somebody intervenes and does laser vision correction, in which case those people are opening themselves up for the potential of a corneal transplant later on. And Janice was one of those kind of people. Her scan permitted me to say, no, you can't have this done. And once or twice a month, I see a lot of people coming to find out if they're candidates, but once or twice a month, I have to turn somebody down. And it's really devastating for the patient because they've spent a year, 2 years
Probably considering if they want the surgery, right?
thinking whether they want to have it done. And when they come in, they're all psyched up just to find out the details and how to go about it. And I have to tell them, I'm sorry, this would not be safe for you.
Well, it makes sense. And Dr. Gold, just give us the special offer for Connecticut Style viewers.
Anybody who calls in my office and mentions this program gets a $200 per eye discount off their procedure. And we've also extended that to all first responders and active and retired military members to honor their service.
Very good, Doctor. Thank you for being here. Janice, nice to have you here as well.
Thanks, Teresa.